Welcome to Nutrition for Seniors, the channel where we empower you with science-backed advice to help you thrive, not just survive, after 60. Today's video might challenge everything you thought you knew about supplements. Because while vitamins are often seen as miracle pills, safe, natural, even essential, the truth is, some vitamins can actually do more harm than good, especially as we age. In this video, we'll go beyond the hype and reveal the 4 vitamins you should seriously reconsider, or even ditch altogether. And then, we'll guide you through 4 vital vitamins you truly need after 60 to stay strong, sharp, and full of energy. Now, let's face it. The supplement industry is a multi-billion-dollar machine. They sell you the idea that a few pills a day can fix everything: joint pain, fatigue, memory loss, bone health, and more. And while supplements can be helpful, especially when you're lacking key nutrients, the truth is nuanced. As we age, our bodies become less efficient at absorbing certain vitamins, while at the same time becoming more sensitive to excess amounts of others. What once helped you at 30 might become a health risk at 70. Plus, many seniors are already taking medications, and some vitamins can dangerously interact with those drugs, increasing bleeding risk, affecting blood pressure, or straining the liver and kidneys. Another issue? Megadosing. More is not better when it comes to vitamins. In fact, taking high doses of fat-soluble vitamins like A and E can build up in your tissues and lead to serious complications, from liver damage to nerve pain and even increased risk of cancer. This is not to scare you, it's to inform you. Your goal shouldn't be to take every vitamin under the sun, but to take the right ones, in the right amounts, at the right time. In the first part of this video, we'll talk about the 4 vitamins you might want to ditch. And we'll explain why each one can be harmful specifically for older adults. These aren't random warnings, we're looking at clinical research, long-term studies, and medical expert guidelines. Then, in part 2, we'll flip the script and show you the 4 vitamins that actually deserve a place in your daily routine. These are the ones your body needs most after 60, for strong bones, a sharp brain, a healthy heart, and lasting vitality. So if you've ever stood in the supplement aisle confused, or wondered whether your daily vitamin habit is helping or hurting, this video is for you. Let's get started with the first half. 4 vitamins to ditch after 60. Vitamin To ditch number 1, Vitamin A. Vitamin A is essential for vision, immune function, and cell growth. It's found in 2 forms: preformed vitamin A, retinol, which is found in animal products and supplements, and provitamin A carotenoids, like beta-carotene, found in fruits and vegetables. While both forms have benefits, the risks associated with high-dose preformed vitamin A, particularly from supplements, become far more serious as we age. Here's why. As we get older, our liver function naturally declines. Vitamin A is a fat-soluble vitamin, meaning it's stored in the liver and not flushed out like water-soluble vitamins, such as B and C. This makes it easier for vitamin A to build up in your body over time, especially if you're taking multivitamins or separate A supplements. And in seniors, this buildup can be dangerous. One major risk? Bone loss. Multiple studies have shown that high levels of preformed vitamin A can reduce bone mineral density and increase the risk of fractures, especially in older women. A 2002 study published in the New England Journal of Medicine found that women with the highest vitamin A intake were significantly more likely to suffer hip fractures. That's the last thing you want when osteoporosis is already a concern after 60. But that's not all. Toxicity symptoms from excess vitamin A can include blurred vision, headaches, dizziness, joint pain, nausea, and even liver damage in extreme cases. In rare but serious situations, it can also lead to intracranial pressure, a dangerous condition that mimics the symptoms of a brain tumor. And here's the problem: vitamin A is in everything. Most multivitamins include it. Many anti-aging or vision support supplements are loaded with retinol. Even some fortified breakfast cereals and dairy products are packed with it. So if you're taking a supplement and eating a modern diet, you might already be well over the safe upper limit, without even knowing it. So what should you do instead? Focus on provitamin A sources, like beta-carotene from carrots, sweet potatoes, spinach, and butternut squash. Your body only converts beta-carotene into vitamin A as needed, so you won't overdose from food. It's a safer, natural way to maintain healthy vision and immune function without the risks of toxicity. Also, check your supplements. If you're over 60 and your multivitamin contains high levels of preformed vitamin A, often labeled as retinol palmitate or retinol acetate, consider switching to a lower dose formula or one that uses only beta-carotene. Bottom line, ditch the high-dose preformed vitamin A, especially if you're not deficient. You'll protect your bones, your liver, and your long-term health. Vitamin TO ditch number 2, vitamin E, synthetic form. Vitamin E has long been celebrated as a powerful antioxidant, one that fights free radicals, protects your cells from damage, and even slows signs of aging. For years, supplement companies marketed it as the anti-aging miracle vitamin. But here's the truth most people don't know: synthetic vitamin E, especially in high doses, can actually be dangerous, particularly for seniors. Let's unpack why this vitamin, once hyped as a health essential, might be doing more harm than good after age 60. First, it's important to understand that vitamin E is not just one compound, but a group of 8 related molecules, 4 tocopherols and 4 tocotrienols. The most common one used in supplements is alpha-tocopherol, and more specifically, its synthetic form, often labeled as DL-alpha-tocopherol. This synthetic version is not the same as the vitamin E found in whole foods. It's cheaper to manufacture, but less bioavailable and more likely to cause imbalances in the body. Here's where things get troubling. Multiple large-scale clinical trials have found that high doses of synthetic vitamin E supplements are linked to increased health risks, especially among older adults. One of the most notable is the SELECT trial, Selenium and Vitamin E Cancer Prevention Trial, a massive study involving over 35,000 men. The results were alarming. Those who took 400 IU of vitamin E daily had a significantly increased risk of prostate cancer compared to those taking a placebo. But the risks don't stop there. Synthetic vitamin E has also been linked to increased risk of hemorrhagic stroke. Because vitamin E thins the blood, high doses can impair clotting, leading to a higher risk of bleeding, especially dangerous for people already on blood thinners like warfarin or aspirin. Nausea, diarrhea, fatigue, and blurred vision. Common symptoms of vitamin E toxicity when levels build up over time. Interactions with medications. It can interfere with chemotherapy drugs, statins, and some blood pressure medications, making them less effective or more dangerous. And here's the kicker: most people aren't deficient in vitamin E to begin with. It's found in plenty of healthy foods: almonds, sunflower seeds, spinach, avocado, olive oil, hazelnuts, and more. These sources provide natural vitamin E, which includes the full spectrum of tocopherols and tocotrienols, not just the isolated, synthetic alpha version. So why are seniors particularly at risk? First, because the immune system weakens with age, many seniors turn to vitamin E thinking it will strengthen their defenses. But studies have shown that megadoses don't improve immunity in the elderly and may actually impair T-cell function when taken in excess. Second, seniors are more likely to be on multiple medications, increasing the risk of dangerous interactions with vitamin E's blood-thinning properties. And since older adults often have slower liver metabolism, vitamin E can accumulate more readily and increase toxicity risk. If you're still taking a multivitamin, flip it over and look for DL-alpha-tocopherol. That's the synthetic kind you want to avoid. Better yet, consider skipping the supplement altogether unless your doctor specifically recommends it, especially if you're already getting enough vitamin E from your diet. Instead, turn to food-based sources of vitamin E. Just a small handful of almonds or a spoonful of sunflower seeds can meet your daily needs. These forms are balanced, natural, and unlikely to push you into excess. Bottom line, synthetic vitamin E isn't just unnecessary, it may be actively harmful after 60. Ditch it in favor of natural sources, and don't fall for the antioxidant hype. Vitamin TO ditch number 3, iron, when not deficient. Iron is often considered a vital mineral, essential for producing hemoglobin, the protein in red blood cells that carries oxygen throughout your body. For younger adults, especially women of childbearing age, iron supplements can be lifesavers to prevent anemia. However, after age 60, iron supplementation can often do more harm than good, particularly if you are not clinically deficient. Here's why iron can become a problem in seniors. The risk of iron overload. Unlike water-soluble vitamins, iron doesn't have an efficient way to be excreted once absorbed. Your body carefully regulates iron absorption based on need. But as we age, this regulation can falter, and excess iron can accumulate in organs such as the liver, heart, and pancreas, a condition known as hemochromatosis or iron overload. Iron overload is dangerous because it promotes oxidative stress, the production of harmful free radicals that damage cells and tissues. This oxidative damage is linked to increased risk of liver disease and cirrhosis, heart problems, including arrhythmias and heart failure, diabetes, joint pain and arthritis, neurodegenerative diseases like Alzheimer's and Parkinson's. Iron is a pro-oxidant in excess, meaning it fuels inflammation and tissue damage. This is the exact opposite of what most seniors want: less inflammation and more cell protection. Why iron deficiency is less common after 60. Postmenopausal women and older men generally have lower iron needs than younger adults. Without monthly blood loss, periods, iron deficiency anemia becomes rarer. Moreover, many older adults have chronic low-level inflammation, which actually traps iron in storage sites and reduces its circulation, a condition called anemia of chronic disease. Supplementing iron in this state won't help because the problem isn't lack of iron, but rather how the body handles it. Risks of unnecessary iron supplementation. Taking iron supplements when you don't need them can cause several problems. Constipation, nausea, and stomach upset, common side effects of iron pills. These can be particularly troublesome for seniors, who may already have digestive issues. Increased infection risk. Bacteria thrive on iron, and excess iron can worsen infections by feeding harmful microbes. Interaction with medications. Iron can bind with antibiotics and other drugs, making them less effective. Increased oxidative stress, as mentioned above. How to know if you need iron. Before adding iron supplements, it's crucial to get your iron status tested by your doctor. Simple blood tests like serum ferritin, transferrin saturation, and complete blood count can show if you have true deficiency or overload. If you're not anemic and your ferritin levels are normal or high, supplementing iron is unnecessary and potentially harmful. Food sources versus supplements. Most seniors get enough iron from their diets, especially if they eat lean meats, legumes, leafy greens, and fortified cereals. The body is better at regulating iron absorption from food, so iron toxicity is rare from natural sources. If you are iron deficient, your doctor will guide you on safe supplementation. Otherwise, it's best to avoid over-the-counter iron pills. Summary. Iron supplementation after 60 is not a one-size-fits-all solution. Taking iron without clear deficiency can cause iron overload and serious health problems, including heart and liver damage. If you haven't been tested recently, don't start iron supplements blindly. Talk to your healthcare provider and get proper blood work done first. Bottom line, unless you're diagnosed with iron deficiency anemia, it's best to ditch iron supplements to protect your organs and reduce inflammation risk. Vitamin TO ditch number 4, vitamin B6, overuse. Vitamin B6, or pyridoxine, is crucial for many bodily functions, from brain health and mood regulation to metabolism and red blood cell production. Many seniors turn to B6 supplements hoping to boost energy, improve memory, or alleviate nerve pain. While vitamin B6 is essential, taking too much can actually cause serious nerve damage and other health issues, especially in older adults. Why vitamin B6 is a double-edged sword. Vitamin B6 is a water-soluble vitamin, meaning excess amounts are usually excreted through urine. Because of this, many believe it's safe to take high doses without worry. However, research shows that chronic high doses of vitamin B6, especially above 100 mg per day, can be toxic, leading to sensory neuropathy. Sensory neuropathy is a condition where nerve fibers, especially those in the hands and feet, become damaged. Symptoms include numbness, tingling, burning sensations, difficulty walking, loss of balance. For seniors, who are already at higher risk for neuropathies due to diabetes, circulation problems, or vitamin deficiencies, adding excessive B6 can worsen or even cause irreversible nerve damage. What studies say about B6 toxicity? Several case studies and clinical trials have linked long-term use of high-dose vitamin B6 supplements to neuropathy. Symptoms can appear gradually and may be mistaken for other age-related issues, delaying diagnosis. Interestingly, symptoms often improve when supplementation stops, but recovery can be slow and sometimes incomplete, especially in older adults. Recommended dosages and safe limits. The recommended dietary allowance, RDA, for vitamin B6 for adults over 50 is about 1.5 to 1.7 mg per day. Many over-the-counter supplements provide doses far exceeding this, sometimes up to 100 mg or more. The tolerable upper intake level, UL, for vitamin B6 is set at 100 mg per day for adults. Doses above this are associated with increased risk of nerve damage. Many multivitamins provide a safe, low dose of vitamin B6 that meets the RDA. Problems arise when seniors take additional high-dose B6 supplements, often marketed for energy or nerve support. Why do seniors take excess B6? To treat peripheral neuropathy symptoms, sometimes prescribed by doctors in high doses. To boost energy and mood. Due to misinformation or over-the-counter availability. While there can be medical reasons to take higher doses under supervision, self-medicating with large amounts of vitamin B6 is risky and should be avoided. Natural sources versus supplements. Vitamin B6 is abundant in many foods, including poultry, fish, potatoes, bananas, and fortified cereals. A balanced diet typically provides sufficient amounts without the need for large supplements. What to do if you suspect B6 toxicity? If you're experiencing numbness, tingling, or unusual sensations in your hands or feet, and you take vitamin B6 supplements, it's important to stop the supplement immediately. Consult your healthcare provider for diagnosis and management. Avoid self-medicating with other high-dose supplements. Summary. Vitamin B6 is essential, but overuse can lead to serious, sometimes irreversible nerve damage, especially in seniors. Taking more than the recommended amounts isn't better, it's dangerous. Bottom line, stick to vitamin B6 doses close to the RDA, ideally from food or low-dose multivitamins. Ditch high-dose vitamin B6 supplements unless prescribed and monitored by a doctor. Thank you for staying with us through this detailed guide on vitamins to ditch and vitamins to take after 60. This is important information that can truly impact your health and quality of life as you age. To recap, we started by highlighting 4 vitamins that many seniors take without realizing the potential risks. Vitamin A in high doses, which can accumulate and harm your bones and liver. Synthetic vitamin E, which may increase risks of cancer and bleeding. Iron supplements when not deficient, which can cause dangerous iron overload. And vitamin B6 overuse, which can lead to nerve damage. These are not warnings to stop all supplementation, but to approach supplements with caution and awareness. More is not always better, especially when it comes to vitamins and minerals after 60. Taking high doses or unnecessary supplements can lead to toxicity, interfere with medications, and cause side effects that are easily avoidable. On the other hand, there are 4 vitamins that research strongly supports for seniors to include in their routine. Vitamin D3 for bone health, immune support, and mood. Vitamin B12 to prevent anemia, cognitive decline, and fatigue. Magnesium, essential for muscle function, sleep quality, and heart health. And vitamin K2, which works alongside vitamin D to support strong bones and cardiovascular health. These nutrients become more difficult to absorb from food alone as we age, and supplementation, guided by your healthcare provider, can help fill the gaps and promote longevity and vitality. Final recommendations. Consult your healthcare provider before starting or stopping any supplement. Blood tests can identify deficiencies or excesses so you get exactly what your body needs, no more, no less. Focus on a balanced diet rich in whole foods. Fruits, vegetables, nuts, seeds, lean proteins, and healthy fats provide vitamins in their natural, safest forms. Choose high-quality supplements when needed, those with bioavailable forms, free from unnecessary additives and synthetic versions known to cause harm. Avoid megadosing and self-medicating. Supplements should support your health, not endanger it. Stay informed. Science evolves and so does our understanding of nutrition, especially for older adults. Why this matters. Your body changes as you age, your metabolism slows, your digestive system becomes less efficient, and your nutrient needs shift. What worked for you in your 30s or 40s might not be right now. By making informed choices about vitamins, you're investing in your long-term health, mobility, cognitive function, and independence. Remember, supplements are just one piece of the puzzle. Regular exercise, proper hydration, quality sleep, and stress management are equally important to living well after 60. Don't forget to subscribe. If you found this video helpful, please hit the subscribe button and ring the notification bell so you won't miss any of our weekly tips designed specifically for seniors who want to feel vibrant and strong every day. Leave your questions and experiences in the comments. Have you ever been surprised by a vitamin that turned out to be harmful? Or maybe you have a favorite supplement that truly works for you. We love hearing from you. Thanks for watching Nutrition for Seniors. Stay healthy, stay informed, and see you in the next video.